Hi, I'm Wlasak, and I'm here to share my capstone with you, which is on Chinese medicine for treating the dissociative subtype of post-traumatic stress disorder. How did I come to this topic? My father was a German soldier during World War II, and my mother was a refugee from East Prussia, fleeing with her family from the advancing Soviet army. In the post-war period, it was they and their friends who carried the heavy burden of untreated PTSD. Growing up in this household, we as children witnessed the suffering of untreated PTSD and what it entails. It is also worth noting that my parents were adolescents during the war, and it is their lives and these personal experiences that drove this capstone into being. Now, I just want to take a moment to give special thanks to my advisor, Dr. Robin Saunders, for her invaluable guidance and support. Dr. Mark Saunders for his insights throughout this process, and Dr. Grief on how to conduct effective research. My gratitude also goes out to the faculty of Five Branches University for their contribution in resources and encouragements. My table of contents is introduction, method, results, discussion, and conclusion. Whoopsie, I think we went a little bit too fast here. Okay, so coming to the topic of PTSD and why it matters. PTSD is a significant mental health condition, and globally it affects approximately 3.6% of the population, according to the WHO. I also have here some data from the NIH, the National Institutes of Health. Approximately 5% of the US adults have PTSD annually. It is estimated in 2020 that about 13 million Americans were diagnosed with PTSD. The gender difference between female and male is 8 to 4%, between veterans and civilians, 7 to 6%. What is the impact of PTSD? Lower academics, depression, suicide, and substance abuse. The annual cost in the United States for a US citizen is over $232 billion. And the comorbidity for the dissociation subtype is 14.4%. Now let's start with what is dissociation. According to the American Psychiatric Association and the Diagnostic Statistical Manual 5th edition, dissociation is a disruption in the integration of consciousness, memory, emotion, perception, body image, and behavior. In order to be diagnosed with dissociation, one has to show symptoms of either depersonalization or derealization, which is ongoing, persistent detachment of mental processes or the body, and derealization is ongoing sense of unreal or distorted environments. The exclusion criteria is that these symptoms cannot derive from substances such as alcohol or due to a medical condition. How is PTSD treated with Western medicine? We have two factors, psychotherapy and pharmacology. Psychotherapy, we have a tremendous value here of treatments like the cognitive processing therapy, which helps with reframing negative thinking, prolonged exposure therapy, which helps patients gradually to make them aware of the traumatic situations again, or sites, and cognitive behavioral. Whoops, here's a little disturbance. Not sure what that is. Oh, okay. Right. Okay. Hang on. This was, I'm not sure what this was.
You're all going to the end. Hold on, pause it. Let's read through. Hold on. I thought.
Okay.
Regroup yourself. You're right. there. And you want to go on one more?
The next, yeah.
Okay, excellent.
Mm.
Okay, is this the right
Yeah,
one?
that's the right one. Thank you.
Okay.
Okay, so cognitive behavioral conjoint therapy is a therapy for couples to learn nonviolent communication. Eye movement desensitization reprocessing is a therapy especially for PTSD patients. It's a bilateral stimulation therapy that can be utilized through the eyes, but also through tapping and sound. We have medications that are SSRIs and SNRIs, which are Zoloft, Prozac, Praxil, and Effexor, usually in Western medicine, and the integration of CAM, which are complementary alternative medicines, is usually for the limbic brain or emotional trauma. That can be anything like movement therapy or sound therapy or dance therapy or art therapy. The U.S. Department of Veterans Affairs also offers support to children and adolescents. For children, there is play therapy and first aid after traumatic dreams. And all of that is offered with parental involvement. For adolescents, there are 12-step programs and also all the therapies and medications mentioned. And how is PTSD plus the dissociative subtypes treated in Western medicine? So the idea is to stabilize patients before exposure. All the combined therapies are utilized, and the lower the dissociation, the higher is the improvement. There are currently more strategies for the subtype being looked for, perhaps where dissociation persists. Now let's look at the treatment of PTSD with Chinese medicine. We know about this treatment gap. We have a holistic approach, which means Chinese medicine works on the body and the mind. It has historical efficacy, so Chinese medicine has been treating psychology or psychological issues for thousands of years. There are fewer side effects, natural remedies versus pharmaceuticals, personal care, and Chinese medicine can be evidence for it. Now let's go a little bit deeper with Chinese medicine so that we really understand why it is a body-mind connection or why it is a non-dual therapy, because body and mind in Chinese medicine is one. And here is a quote from Li and Liu: essence, blood, fluids, humors are the material basis for the mind or the spirit. How did this body mind split occur in Western culture, or how did it happen? It happened through the saying, cogito ergo sum, I think, therefore I am, were the statements from René Descartes, which introduced dualism and the body-mind divide. Going onward with understanding Chinese medicine, we have to look at the key concept of the correspondence ideology. And we have examples here, which are foundational examples in Chinese medicine. So correspondence means the intricate interconnectedness within a system, not just the body-mind, but within various meridian structures, or the foundational understanding of yin and yang. It's what we start with. The 5 phases. How does qi get affected? It gets affected through the emotions. We have the 7 emotions in Chinese medicine. When we're angry, the qi rises. When we are joyful, the qi relaxes. When we're sad, the qi dissipates. When we're afraid, the qi descends. And when we're in fright, the qi disorganizes. My hypothesis is this open study on the use of Chinese medicine for treating the dissociative subtype of PTSD reveals limited English language documentation on this topic, highlighting the need for further research. Coming to my method now. My inclusion criteria for this capstone were peer-reviewed gray literature, unpublished and published, randomized controlled trials, case series, and case studies. I only included English language studies except one. I found an incredibly valuable German study, but unfortunately there was no Chinese medicine utilized in the study, so it was excluded. In my participants had to be humans over 6 years, diagnosed with PTSD plus DS. The diagnosis had to be clear, and the dissociative symptoms had to be a clear documentation or clear description or measurements. The exclusion criteria were articles not addressing Chinese medicine for the dissociative PTSD, studies involving individuals below 6, studies not focusing on dissociative PTSD or Chinese medicine or acupuncture, and studies not available in English. My research databases were PubMed, ScienceDirect, PsycInfo, Google Scholar, and the search period was from June 2022 to present, and I only accepted full text only. Here you see my medical subject headings. So traditional Chinese medicine, acupuncture, acupuncture therapy, stress disorder, post-traumatic, and the dissociative disorders. I did a supplementary search on Google Scholar and put the keyword pathological dissociation, TCM, acupuncture, and excluding animal research. I did manual researches, backward and forwards list of citations. I also consulted experts in the field of Chinese medical psychology and classic Chinese medicine. Here's an overview of how I came down to my 2 studies that are included. Here is the Prisma flowchart. So I had altogether 1,087 studies that I found. There were 28 duplicates that were excluded. Also 716 studies were excluded because they were not relevant. So I had screened 335 studies, from which 321 were excluded based on title and abstract. So I had for full text, I had 14, but it turned out 3 didn't have full text. So I actually then had 11 studies that were eligible for this review, from which 9 were still excluded because 6 didn't have the dissociative PTSD and 3 didn't have Chinese medicine. So included in the study are 2 studies. Coming to my results and discussions. So Chinese medicine, so this first study that I found was focusing on dissociative disorders in ancient Chinese culture. And this was like finding a needle in a haystack. It was almost impossible to find anything on dissociation until I found this study. And it was a very interesting study. It was showing and investigating 6 cases, 6 patients in the ancient Chinese literatures. And there were, bingo, there were 5 dissociation symptoms being found. So we had trance state, somatoform symptoms, we had dissociative amnesia, identity alterations, which is typical for dissociation, and dissociative flashbacks. And this study was highlighting that this is a human phenomena and not a cultural phenomena. So these 6 cases, you see them here, just kind of briefly listed. So the first case was a man that woke up one morning and had altered consciousness, identity alterations, and amnesia. The second was somebody was not speaking anymore, not eating anymore, and he forgot that he had a wife and a son. The third one was an identity alteration after childbirth. The woman had very difficult childbirth, but actually the child died. And so she spoke fluently Mandarin after that. So her shock situation after losing her child had another identity that was able to speak fluently Mandarin, which was not her accent. The fourth case was also very interesting, was ghost disorder. This happened after a person was redecorating an altar for a friend, and he was basically possessed by an entity after that. The fifth case was an eye disease that was not a physical symptom or not found through any physical issues, but was more like a psychological issue. The sixth one was a classical PTSD one, because this woman was in a hotel that was robbed and put on fire, and she had dissociative flashbacks and fear afterwards. The keystone of this study was finding these ancient terms for potentially depersonalization, PTSD, all these terms we have nowadays. So Shui was evil influences. Hui, we know, means ghost. Sui means occupied by a ghost. Lihun and Shun are really important ones because these are names for depersonalization, which is the feeling of being a spirit being away from your body, or the loss of spirit. And Jingquan went beyond the scope of this study, which is really mania. Beyond those findings, also San Siomao was mentioned in this study, who was in the 7th century, and he challenged this belief of angry spirits and introduced the concept of phlegm in mental disorders. He also went on to create ghost points and to treat ghost disorder.
15 minutes.
Thank you. Moving on to the second study. We know that trauma can happen through physical abuse, emotional abuse, violence, war, surgery, complications, even motor vehicle accidents, and emotional shocks. So according to Fai Boishong Insights, the 7 emotions injure the 5 yin organs selectively, but they all affect the heart. So we're coming now to this other aspect from the body-mind split to this heart-mind split relationship. So what are some of the physical aspects of trauma on the body? It impairs circulation. We're depleting the heart qi and the blood. Emotional shock is more the depletion of heart yin, but it also affects the qi and the blood. And every heart shock affects circulation, according to Dr. Sickley and Dr. Rosen. Here I went into the classics, the Su Wen, and found some important aspects here from Wanbing. In case of fright, the heart has nothing to lean on, nothing to return to. The qi in the chest is in disorder, hence the resulting panting originates from the lung. Wanbing also states, in case of fright, the spirit leaves its residence. Hence, the qi overflows, turns against the heart, and harms it. The heart controls the spirit brilliance. We know this is Shen Ming. In case of fright and fear, the qi rushes upward against the lung. Spirit brilliance rebels in disorder, and the heart, contrary to normal circumstances, is harmed by it. Now let's look at the heart one more time in Chinese medicine. It's translated into Shin, and see here the heart is capitalized. So we're not necessarily talking about the organ of the heart like we think of it in Western medicine. No, we think of the official here, which is the emperor. So in Chinese medicine, the heart is the ruler, and it's steering a flourishing nation. The flourishing nation is literally the entire human being. And a healthy emperor also embodies a Taoist principle, which is the principle of Wu Wei, which means effortless action or effortless mastery. The steady heart beating represents the drumming of heaven, and a proper heart function sustains life. So it's a living heart. Shin also means in Chinese medicine heart-mind. So heart-mind is one in Chinese medicine as well, and it is associated with the heart. And not only that, the heart also houses a very important principle in Chinese medicine theory, which is the Shen, which is the spirit. And we see this in human beings' eyes. When the spirit is alive, we can see this sparkle in people's eyes. I went again into the Su Wen and looked at this reference, and here it says the heart stores the spirit. So the 5 depots, as we know, the lung houses the po, etc. Disturbances to the heart lead to the ghostly existence and loss of humanness. So the heart-mind relationship and dissociation consequences creates the so-called heart-mind split. When heart and mind, heart yin, heart yang, dissociate in the moment of an overwhelming experience, The little mind takes control. You see here mind not capitalized, and takes control, bypasses the heart, bypasses intuition, and replaces it with reason, leading to a loss of this very delicate balance of the heart. Here, according to Dr. Leon Hammer, we see a definition of heart yin and heart yang. So heart yin represents divine revelation and inspirational creativity. Heart yang is the divine intelligence. And this correspondence here is that the heart yang has this ability to convert the creativity of heart yin, which is really the blood essence, into form, and gives it order. So Dr. Hammer says if we have only heart yin, everything would just flow out. And if we had no heart yin, then there would be only bureaucracy. So this principle is often overlooked in Western culture and in Western medicine. So the effects of the heart-mind split is mind control and loss of intuition, and the symptoms are anxiety and depression, which we see pretty much in PTSD patients. The treatment challenge here is that mostly those patients are treated for anxiety and depression, mainly with pharmacology, and this internal heart-mind split is overlooked, and often actually these treatments drive this heart-mind split even further in. So, and also there is the dependency to antidepressants and anxiety medication. So now here is this other incredible finding about this research, which is the so-called heart opening process. So what acupuncture has to offer here is to reevaluate this heart-mind spirit loss, if you will, or this disorganization of that through the so-called cardinal heart points that are on the kidney meridian. So if you, for a moment, even hold your own chest, which we sometimes do, then we come basically to those three cardinal heart points, which are in the fire phase. So in the fourth intercostal is the kidney 23, and it means spirit seal. And this point represents and seals the heart yang, and the container is the water. And treating this point helps people with their passion and also their divine will, and being on the true path of their heart. Kidney 24 is called Ling Shu, and Ling means the yin aspect of spirit. And this is very useful for patients with PTSD that have a hard time letting go of deceased ones or loved ones. It is also part of a karmic transformation. So there is the ego death involved. So this little mind aspect actually reemerges or emerges back into this higher mind, or this divine intelligence and this divine creativity. The third point, which is in the second intercostal, is kidney 25, and this is called spirit storehouse. So here we can think about the heart, mind, spirit loss, and can help patients to reconnect with the spirit. So if the spirit leaves the body, or the Shen leaves the heart, then there is this process of reintegrating the Shen, or reintegrating the spirit loss. And all three of those points can be incredibly valuable and important for this heart opening process. One should palpate these points for tenderness on patients, but also one may want to palpate and include the mu points of the heart, Ren 17 and Ren 14, because often you may find also tenderness in these points, and where patients carry the PTSD for a very long time. Moving onward now, what further was the result of this capstone is Wu Wei in practice. Wu Wei is the state of the emperor, is the natural state of being versus the state of doing. And very important is that we all know in practice, we very quickly go into the state of doing. And it is important for the practitioner to maybe center themselves before and also begin or learn, maybe through meditation or walking in nature, to embody the state of the heart or the Taoist principle of Wu Wei. So this is about trusting our intuition, which is about also being present in the moment. What's also really important, and it points to the Lingshu chapter 8, which is, Jeffrey Ewan says it in one of his talks. He says, based on Lingshu chapter 8, to consider the spirit
You're all good. You're all good. There you go. You may have to.
Yeah, I'll do it.
Hold on. Okay, recording still going. You're good.
Okay, so the findings reveal significant gaps, including the absence of adolescent-specific treatment, limited coverage in the DSM-5, and insufficient information on various Chinese medicine modalities. I didn't find anything about Chinese herbs, nothing on extraordinary vessels in the databases. Obviously, there's other literature that we have in Chinese medicine. And so more research certainly necessary. This really underscores the need for more research and translation efforts, because there are more of those Chinese studies out there. And I just happened to find this one needle in the haystack. So really hoping there's more coming forth. So exploring the holistic aspect of Chinese medicine and its integration with Western medical psychology really holds promise for a more comprehensive treatment possibilities for dissociative PTSD and the heart, mind, spirit integration. So here we go. My limitations were that the researcher was not speaking Chinese language, also no expert in Chinese ancient philosophy. So there was the reliance on English translated studies, and this introduces obviously an interpretational bias. The scope of the focus was mainly on foundational aspects of Chinese medicine. And Chinese medicine obviously has more diverse components that went beyond this particular study scope, but more should be done. And the incompleteness of this analysis is also around Chinese medicine pattern suggestions and more acupuncture points to bring in a broader scope for the application of dissociation. Future research directions: subtypes, Chinese medicine into clinical practice with modern mental health approaches. Also to define hard yin and hard yang in relation to client progress more, engage with peer review and future research to advance integrative.
Yeah, 1 minute left.
Thank you. To integrate Chinese medicine into Western medicine approaches. Also, I think it is very important to address more vulnerable age groups, which are adolescents and children. So adolescents 10 to 19, young adults or young people 10 to 24. And we can also include children 0 to 18 that potentially have adverse childhood experiences that absolutely lead to dissociative behaviors, and also to reevaluate the DSM-5 and APA guidelines. And yeah, so I have a little hope that potentially at some point we have a keyword that is called not PTSD, but PTDD, post-traumatic dissociative disorder. So yeah, so more can be done in this field that is highly underestimated.
All right. Good job.